NHS is facing a crisis. At least that's what most people seem to believe. Even the government says there isn't one, only because they have made plans. Where the big argument lies is what to do about it, crisis or otherwise. So let's bring together three people with different experiences. Stephen Dorrell chairs the NHS Confederation. He was himself a health secretary. Adam Kay was a doctor. He's now a comedian. He's written a book about it all, Secret Diaries of a Junior Doctor. And Dr. Anne Blackwood is the boss of Health Enterprise East, which advises the NHS and the private sector on technology. Stephen Dorrell, there isn't a solution that does not involve extra resources, and the NHS cannot go on as it is. That's your view.
That is my view. That's correct. I think there's a tendency for a rather sterile debate. Is this a matter of resources or is it a matter of rethinking structure? The answer is it needs to be both. When we see pressures within A&E departments and other points of access to the NHS that demonstrate strain, I think what we have to recognise is that this should be seen really as a canary in the mine, as a warning sign, not just that the NHS is under stress, but the range of public services, including social care, including social housing, including the range of public services delivered by local government, are not meeting the demands being placed upon them. And the place where that unmet need presents itself is in the point of immediate access to the NHS. What we need to think about is where the trends are going in terms of demand for public services and how those trends can be effectively met, thinking through the implications of that, both in terms of money and in terms of structure.
And you were nodding your head at a lot of that, Adam Kay.
It's absolutely right. We need to think of the NHS in very broad terms. Social care is part of it. If there's nowhere for the patients to go when they're discharged from hospital, they can't be discharged from hospital, new people can't go into hospital. You're exactly right. We sometimes think about it too narrowly. I think, potentially, and this is probably pie in the sky, the NHS shouldn't be managed by the government so much as a cross-party, parliamentary, strategy unit.
Wishful thinking.
It is wishful thinking.
Because it's a huge political football, the NHS always has been, always will be.
It is, and this football is held by sort of short-term, here today, gone tomorrow, ministers, and it's so much more important. The NHS is more than this organisation. It's hundreds of thousands of people giving their everything and currently failing to achieve what they're desperately trying to do.
What about a sort of 10-year budget plan then? Because I think that's what Mr Hunt wants, isn't it? Or something like that. Would that help?
If it's organised by Mr Hunt, probably not.
Well, I'm not going to personalise it to Jeremy Hunt, but I don't think you can remove public services from politics. I don't think you should try. If services are paid for by taxpayers, taxpayers will want their elected politicians to be accountable for the outcomes that are achieved by those public services.
All right.
But what you can do is to encourage cross-party dialogue about the things that are common ground between different people from different political traditions.
All right. Well, Anne Blackwood, give us a technical solution.
So I think one of the questions is, what can the NHS do differently? Everyone understands what the current challenges are, but what can we do about it? There's no shortage of innovative ideas in the NHS that could transform care pathways, improving both the quality and efficiency of services.
Why are they being done?
Well, the research and development carried out by the NHS on a daily basis is world leading. We spend over £1 billion a year on those research and development services, but we spend a very small amount of that, a fraction of that, in actually diffusing and implementing those ideas, and that's one of the challenges. The NHS often struggles to adopt the very innovation that it discovers.
But this is a bit difficult for most people, certainly for me to grasp, because the idea of all these innovative ideas. Give us an example. A hard example of the kind of thing that the NHS could do tomorrow or next week or next month that would make a difference.
So the NHS could make much greater use of digital health technology to help empower patients who have a long-term health condition, who consume quite a lot of NHS resource, 50% of all GP appointments, 70% of all hospital bed days, using digital health tools that would enable
Meaning
patients...
what? What would you do? You're sitting at home, you're on your computer, what do you do?
So if, for example, you have a respiratory condition like COPD, which is a pulmonary disease, and you need pulmonary rehabilitation in order to stay well and healthy and out of hospital, particularly during the winter months, which are particularly difficult for this group of patients. And this is a disease that costs the NHS £1 billion a year. Treatment is complex, using different inhalers, and compliance with that treatment is often low, which leads to poor outcomes. So if we could use digital tools to help patients in the home do their pulmonary rehabilitation, stay well and healthy, stay out of hospitals, that will lead to better outcomes for patients, and it will also save money for the NHS.
All right, there's an example then. As a former doctor, Adam Kay, would that work? That sort of thing, I mean.
That sort of thing would help to a certain extent, but it's a very small fix.
Well, £1 billion here, £1 billion there, pretty soon you're talking real money.
It's true, but it needs real money soon, and the money needs to be invested in staff to raise morale, because there are critical problems with retention, with recruitment, and all these minor fixes. Without the staff in the NHS is nothing.
Is there an argument, Stephen Dorrell, that says, and you were Health Secretary for some years yourself, so you know about these things, that says it isn't actually, in the end, about resources and about money, well, although that is always, of course, going to be the backdrop to it all, but we have to say, and again we're back to the political thing, aren't we, we have to say the NHS, as it stands, which is, of course, a religion, may not be any longer fit for purpose.
I think it follows from what all of us have been saying, actually, that thinking of the NHS as a silo, or more accurately as a collection of silos, GP services, community services, hospital services, that version of the NHS is not fit for purpose. What we need to be thinking about is a range of public services that identify particular needs as early as possible and meet them as effectively as possible, so that people don't have to present to hospital. Can I humanise that based on this, on the example of pulmonary disease? Too many people feel the need to go and see their GP, or when they can't see, or when they feel they can't see their GP, they go to the A&E department for reassurance, because they're living with a condition that they're not sure what the symptoms actually mean.
You can't get that from a computer.
And you can't get it from a computer, but what you can do is set up an infrastructure to support people to live at home with the support of friends, family, and for professionals available to them when they need them. What we shouldn't have people doing is presenting for a whole series of disconnected episodes with information not flowing round the system as it could if we put the proper infrastructure in place.
And Adam Kay, should we look at how we spend the money as well, in terms of things that, I don't know, maybe prescriptions for people who are getting aspirins on the NHS, could go and buy the aspirin in Boots for tuppence halfpenny, and instead they,
Yeah, there are many, many, many little things that can be done, but the OECD agree that the NHS is an extremely efficient version of delivering healthcare. The bottom line is there just isn't enough money, and the money needs to be spread across a lot of places, but shouldn't be, as someone who's experienced lots of NHS innovations and failed computer technology in hospitals, the money needs first of all to go to the front line, to the staff.
A quick thought about rationing. More rationing?
This is, if I may say so, people, Adam said people come and go in this world. I was first a health minister 27 years ago now, and people, the debate, should we ration, has been around for the whole of that 27 years. Mm-hmm. The truth is, within any public service, taxpayers quite properly expect us to make decisions about priorities. And if you want to call that rationing, that's rationing. My priority, I believe our collective priority, ought to be to take advantage of the opportunities presented by modern medicine to enable us to lead not merely longer, but also more enjoyable lives.
Well, there, I'm afraid we must end it. Sorry about that. Stephen Dorrell, Anne Blackwood, Adam Kay, thank you all very much indeed.